Done. We begin with Dr. Brooke Cunningham from the University of Minnesota. She studies equity issues in minority communities. Could we start with your research, and I'm going to do this in air quotes, your research during normal times? Can you pull out some big themes that you see in medical care outside of a pandemic?
So I study health equity and health disparities and racial disparities in general. I have studied the organizational response, sort of barriers and facilitators to adopting health equity. So basically, long story short, is stress activates bias. Being under stress, being under anxiety, having high levels of uncertainty, having too much to do and literally too much to think through, what is called high cognitive load, all those make us fall back on bias, both implicit and explicit bias. And certainly in a time of pandemic, all of those characteristics apply. Things are changing daily. There's a lot of fear. So we are ripe in this situation for even the best intended people to make errors in judgment and stigmatize already marginalized populations.
I did want to try to localize this just a bit because unfortunately one of the storylines that's been generated by our state is nation-leading disparities. You see this when you look at education, right, income, all these different factors.
Right.
Based on that sort of unique fingerprint we have here, do you expect this pandemic to sort of pull out some of those really noticeable disparities? Are we going to repeat the same refrain here?
I think we will, unfortunately, just because the pandemic is so tied to risk, not the pandemic, but risk of acquiring COVID-19 infection is so tied to social location. I think what is working in on our side and hopefully can compensate for some of these problems with social stratification by race is we do have a relatively high quality healthcare system. There are a lot of people who are attuned to these issues. And so there is a contingent of people within healthcare systems who have equity right there at the front, right there at the forefront. So that gives me hope.
It makes me wonder, is there an administrative responsibility? If we know that when medical care providers are stressed and fatigued, their biases come out, is there sort of a moral imperative on the part of the institution to schedule in a way that you're not putting a fatigued care provider into a situation where those biases might come out?
I think we do need to take care of care providers. I think this is a very challenging time for everybody who's on the front lines. I think the challenge, in an ideal situation, if sort of hospitals weren't being slammed, which is perhaps where we are right now in Minnesota, we're still within a frame where it seems like we still have supplies, it seems like we still have ICU beds. So I think Minnesota has an opportunity at this point because we sort of have not been hit in the same way. We're at an earlier phase than many other states for administrators to start thinking proactively about ways to address racism and stigma when it comes up in clinical care settings.
Dr. Brooke Cunningham of the University of Minnesota, thanks so much for your time. Really appreciate it.